While trying to take a sip of hot coffee, your hand suddenly begins to shake violently. The more you concentrate on holding your hand steady, the more it shakes. You spill coffee all over yourself. You're not only embarrassed, but you have also ruined your new shirt. I'm going to tell you about a condition known as benign essential tremors. Some of the key symptoms for benign essential tremors include involuntary, rhythmic, and oscillatory movements of the body part, such as the hands, due to a contraction of opposing muscles. Typically, this involves the hands, as I mentioned, and the forearms, but it can also involve the head and vocal cords. It closely resembles Parkinson's disease. Diagnosis, according to the Stat Consult, the clinical diagnosis is based on patient history and a physical exam. Most often, tremor disorders are misdiagnosed. The physician must rule out several conditions. These include enhanced physiological tremors, spasmodic torticollis, hyperthyroidism, Parkinson's disease, psychogenetic tremors, dystonia, and even Wilson's disease, and medication-induced tremors. So, how many Americans suffer with this condition? According to Healthline.com, approximately 10 million Americans suffer from benign essential tremors. Who might you know that has had this disorder? According to the New York Times, Katharine Hepburn herself had benign essential tremors. It affected her voice and her head, and most people speculated that she had Parkinson's disease instead. And also, I have this condition myself. Can this condition be inherited? According to the International Neuropsychological Society Journal, if you have this condition, your children are 50% more likely to develop it as well. Certain factors may make the tremors temporarily worse than normal. Emotional stress, such as a public speaking event, fatigue, excessive hunger, very cold or very hot temperatures, caffeinated drinks, or smoking cigarettes. Although there is no cure for benign essential tremors, there are potential treatments. These treatments may include prescribed medications, a surgical procedure known as deep brain stimulation, which sounds very painful in and of itself, but most patients tend to forego these treatments and decide that they want to self-medicate. And one way to self-medicate is with alcohol. A very low dose of alcohol, such as 1 or 2 beers, can calm the tremors tremendously. Is benign essential tremors life-threatening, like Parkinson's disease? Benign essential tremors are not life-threatening in and of themselves. This condition can be very debilitating, though. It is very embarrassing to spill coffee on yourself, as I gave in the introduction. And also, public speaking can be very cumbersome. Audiences tend to think that you're very nervous and may actually miss the message that you're trying to communicate. This can cause many patients who suffer from this condition to avoid public speaking altogether, and they may find themselves secluded even more. In conclusion, I have told you about benign essential tremors. We have discussed the key symptoms, ways that it is diagnosed, and if it can be inherited or not, how it can be treated, and people that you may know that have or have had this condition. Although benign essential tremors is not life-threatening, it can be very debilitating.